The Tixel is a device that we use mostly on the face, but we can use it all over the body. It does primarily skin tightening, but it also helps with pigment, pore size. It can treat port of wine stains. It can treat active acne and acne scarring. So it has a quite large array of different disease processes that it can treat. Like any device, especially one that's very warm, so the Tixel gets to 400 degrees Celsius, and we then control essentially the amount of energy and then the time that it's on the skin. So if you went to a med spa that wasn't physician owned and operated and the technician didn't quite know the right settings, especially for someone with darker skin type. So patients who have very light colored skin, you likely can go way up on the settings, put that hot plate on the skin for a long extended period and really go up on the settings, and it wouldn't cause an issue. If someone has a darker skin type, it likely could cause hyperpigmentation and delayed healing. Also, even just in the number of passes, if someone has a darker skin type, again, not only are we starting on lower settings, but likely we may do, a test spot and do a little patch prior just to make sure it heals well on the patient in an area where, if it didn't heal well, it wouldn't be of concern, different than the face. Or we would just do one pass with that patient, and then next time we could always either go up to 2 passes or go up on the settings, or maybe both, depending on if they've had recent sun exposure. This, like several other procedures, we really do have to watch if a patient's had active sun exposure that could cause them to have an inappropriate reaction after the treatment. Also, once the patient is in the procedure, they're numbed for about 45 minutes. When the numbing cream's taken off, we cleanse the face, and then we make sure to take off all the debris from the numbing cream. If there's even just a small amount of debris on the skin, since that plate's so hot, when it's applied to the skin, it could singe if there's anything left, but it also could cause a burn on the area. So you want to make sure your licensed esthetician or medical professional performing this procedure has the best training and are physician owned and operated, and there's a physician that's talking to the esthetician or other professionals who are performing the treatment about the settings, what's most appropriate, and that they have the best possible treatments and outcomes. A lot of the procedures that do similar technology to the Tixel are lasers. So what's really unique about this piece of equipment is the Tixel, because it's not a laser, we can actually place it on the lid. So if we were to do a deep laser procedure or even a superficial laser procedure, we can't treat over the eyes. You would have to either put intraocular shields in, or you're just not able to treat over the eyes. You'd have to make sure, there's bone. So you just have to make sure the patient's properly protected and their eyes are covered. The nice thing about the Tixel is at very superficial depths, we can actually place it on the eyelid. So this is one piece of technology that we're really pushing for our patients that may have laxity above the eye, that may even be thinking about a blepharoplasty, either upper or lower. This can help tighten that skin around the eye and hopefully delay the need for them to get a blepharoplasty.